Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are discussing about a very important topic, which is nothing but PCOD versus PCOS. Many people, especially clients who are coming to our clinic, are asking us if they are suffering with PCOD or if they are suffering from PCOS, and what is the major difference between both of them. How does this affect the fertility rate? How does this affect the day-to-day life? How does this affect the menstrual cycle? And lot more other questions. So today especially we are dividing this topic, which is PCOD versus PCOS, into two parts. The part one will be discussing what is happening internally so that we are getting this disease, that is PCOS and PCOD, and how to differentiate them on a medical basis. And then in the part two we will be learning how to differentiate them based on the symptom basis. So let's dive into the topic. What is the definition of PCOD? So PCOD refers to polycystic ovarian disease. Disease is something which is very pertaining, or which is pertaining only to a certain organ. It can be reproductive, it can be liver, it can be heart. It is a disease itself, defines itself, or it limits itself to an organ. So here whenever we are speaking about PCOD, we are defining it to the reproductive system. So in the reproductive system, what is happening in this PCOD? There are ovaries which release a lot of immature or partially matured follicles, which turn into cysts due to hormonal imbalance. So what is PCOD? It is just ovaries releasing some immature follicles, which due to hormonal disruption are turning into cysts. So this is PCOD, which is pertaining or which is limiting only to the reproductive system. Second, we have PCOS. PCOS is majorly an endocrine disorder, as we can say, because there is problem in the release of GnRH from the hypothalamus, which is situated in the brain, and it stimulates to the anterior pituitary. Apart from that, if we see how else can we define PCOS? PCOS, the ovaries produce higher amount of androgens, that is testosterone. So there is hyperandrogenism with polycystic ovaries. So what is PCOS? PCOS is a syndrome. What is a syndrome? Syndrome is something that affects not only a particular organ but has its effect on overall body. So if you see, PCOS is not just a reproductive disease, it affects the blood sugar levels, it affects the insulin, it affects pancreas, it affects your calcium absorption, it affects your mental health, it has a lot of mood swings, it affects your endocrine function, and also it can have an effect on your thyroid as well. So overall it is causing some disruption, and overall the body, it is causing some symptoms. So that is syndrome. So what happens in PCOS, or how do you define it? Here there is cystic ovaries along with hyperandrogenism. This is how you define PCOS. Then what are the differences in their causative factors? If we see about PCOD, the causative factor for PCOD is hormonal imbalance. See, either in PCOS or in PCOD, we do not know the proper etiology. By etiology, I mean proper causation. We just assume something is happening in the body which is leading to hormonal disruption in PCOD, and excess androgen, excess androgen or hyperandrogenism in PCOS. It is an endocrine disorder. It is PCOD is strictly restricted to your reproductive disease. And then what is the age of onset? When I'm talking about age of onset, it doesn't mean that other people, of the age of, or for example, if I'm telling you that adolescents are being affected in PCOD, it doesn't mean that people who are in their 30s are not affected. It is that these people have a higher risk of developing PCOD. Or if you take 100 cases of PCOD, then 40 to 50% cases are seen in adolescent people. So PCOD is mostly seen in adolescent people, whereas PCOS is mostly seen in adolescents, but much more pronounced in 20s and 30s. If you're someone who's suffering from PCOD or PCOS, you can contact us in person if you're staying nearby the nearest branch of Fidicus, or if you're staying abroad, or if you're staying very far from us, you can contact us online, either through an audio or a video consultation option. And after the consultation has been done, we will ask you for investigations, whatever your case demands. And after the investigations, we will be after all this process is done, especially to the online clients, your medicine will be door delivered to you. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And if you're staying in apart from USA and India, anywhere else in the globe, 4 to 8 business days. If you're someone who is looking for cure, you can contact us on this number. You can call us, message us, or WhatsApp us on this number. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here, if you're someone who's suffering from PCOD or PCOS or any other female reproductive symptoms, why should you choose Fidicus Homeopathy? We have already discussed why should you choose homeopathy over allopathic form of treatment. Now we will be telling you why should you choose Fidicus Homeopathy apart from all the homeopathic physicians in the world. Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. We are doing this video because we have high success rate in treating PCOD, PCOS, bulky uterus, endometriosis, adenomyosis, fibroid cases, and much more other cases. Here we follow 3 principles. High success rate. We are already having or experiencing good success rate in people who are suffering from PCOD and PCOS. And apart from that, transparent treatment. That is, there is no gray area between the patient and the doctor. Here we will be explaining it to you clearly what the prognosis and how your case is going to run. And the personal care here at Fidicus is top notch. The reason why we are doing this video is because we care about our patients. They are asking us a lot of questions about these topics. So that is why in order to educate them, we are doing these videos. So the personal care here at Fidicus is top notch. We will be answering all of your queries and educating you on your disease. So if you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.